what does a Brazilian butt lift actually look like? I have to admit, it's a bit of a frequent but a bit of a peculiar question because not all BBLs, of course, look the same. It depends on what you look like before. It depends on what body we get to work with. Um, but we have certain changes that we try to achieve when we do this kind of body contouring procedure, and I'm going to try to give you a short walk through this. When we counsel BBL patients for the first time, our impression is that people often come with the perception that BBLs look very operated, very exaggerated, and that it generally creates a very artificial and surgical look. I'm going to be honest, we do see patients who actually want that look, who want a very, very graphic waist to hip ratio, but these looks in most cases will require more than one operation. So with one BBL, you see here one example. You see this is what we qualify as probably the maximum possible BBL change. You see the young lady has got a straight waist to hip ratio before, and she changes into a curvy shape. You cannot get more than this in one go. So that's probably very unlikely anybody would say that this is exaggerated. That is what most will qualify as a beautiful and natural result. You cannot get more change in your waist to hip ratio than this. Generally, what we want to do is accentuate the waist. That is probably goal number one when we embark on a Brazilian butt lift. We want to fill out hip dips. We want to create gluteal projection. The defined waist is the most important thing in the BBL. This is what most patients are after. But molding, shaping the buttock, creating hip roundness accentuates the waist. So the primary tool here is not buttock augmentation. The primary tool is enhancement of the waist. Here I'm showing you a case of a slimmer patient with not so much fat, where we actually work with buttock implants too. We quite like to do that in selected cases, not in everybody. It always depends on the individual anatomy, but yes, you can do that with implants too. But again, you do see a change in waist to hip ratio of about 30%. The BBL can change your soft tissue relations. It can accentuate your waist. It can sometimes improve skin tone a bit, not always, but mostly, but it definitely improves your body proportions. And what most patients really want to get rid of is the so-called hip dips. They want an hourglass effect. They want more definition of their waist, rounder hips, what we call the little black dress effect. And in the majority of patients, when we try to dig into what is their idea, what they can do is not always identical with what they want to do, is not always identical with what they can do. But ideally, patients who come with a straight waist to hip ratio want to get a waist to hip ratio of 0.7. I've prepared this example here, which actually shows this straight waist to hip ratio before, waist to hip in a relation of 1, and we changed that to 0.7. That qualifies as a very, very good result. So it's not about transferring as much fat as possible. Really, the key point is sculpting the waist. This is about waist sculpture. It's not about buttock size. And the liposuction is much, much more important than the actual fat transfer. I've prepared another case where you see that is actually a case with implants too, but it's a beautiful case to show the shift in shape. So you change a long and square buttock into a shorter and round buttock. It's not a bigger buttock, it's a different buttock. It's got core projection, it's got a defined waist, roundness on the hips. That is what we want to achieve. And this is the maximum of what you can do in one go. When do you see the final results after this? This is always a bit of a ongoing question, because what is a bit peculiar about BBL, that in the beginning it looks much more dramatic than in the end. That's probably very different to all other plastic surgical procedures. So in the first month, people might look a bit exaggerated. Fun fact, they usually like it. So for us, the bigger problem is that they detach a little bit from their before picture, but only remember the swollen, exaggerated look that they like. You will see about 30% of the fat goes plus 20% swelling or water. So roughly half of what you see in the mirror the first day will go down, and within 3 months, people usually come to their final shape. And the final shape should look like something like this. You see, these are beautiful, probably the best case example ever to demonstrate BBL technique. And what you can easily see here is how important the lipo is. I think you can easily imagine, just by removing the fat, how much we have improved this lady's shape. So a BBL is meant to look more feminine. It shall give you shape, waist definition. It's not meant to look operated. Again, some people want that. We try to make everybody happy. But if you want let's say more graphic look, like the lady that I deliberately picked here, beautiful case, but she did it twice. So to get to this kind of waist to hip ratio, you want to do it twice. But the primary BBL is about waist definition. So BBL will look like, depending on what you look like before, but focusing on a defined waist and a curvy feminine silhouette.